This is a short video about how to best prepare for hip or knee replacement surgery. The good news is that even as recently as in the last 10 years, surgical and anaesthetic techniques have greatly improved to allow earlier, safer and easier recovery from surgery. The key to success is, however, careful preparation. So, what should you do? Step 1. Do your research. The more you know ahead of time, the more informed your treatment decisions will be. When reading online, remember to remain skeptical. You will certainly also want to know that your surgeon is experienced, as less consistently good results are generally seen when surgery is performed by lower volume surgeons or in hospitals that undertake only a small number of joint replacements. In the UK, this information is publicly available. However, finding the right surgeon for you is more than just a numbers game. Your general practitioner, together with friends and family, will be able to make recommendations taking into account other factors such as availability, location, bedside manner and so on. Once you've met with your surgeon and decided to go ahead, you must be sure that you understand what this entails, what the risks are, and indeed what the alternative treatment possibilities are. If in any way you're uncertain, it's advisable to arrange for a further consultation or even seek a second opinion. Step 2. Taking exercise. Committing to some form of regular exercise in the run-up to surgery will greatly facilitate your recovery. What works best will vary, but activities such as swimming or cycling are excellent for building fitness, maintaining muscle function and range of motion. In the last 4 weeks or so before surgery, you should also include strengthening work, remembering also your core and upper body. You'll find details of practical exercise on my website, though it may be useful to see a personal trainer or physiotherapist. Monitoring your activity with a smartphone is a great way to maintain motivation in the run-up to surgery. You can now also download bespoke apps to guide you through the exercises that you should be performing in the weeks and months prior to your date of surgery. Step 3. Get healthy. You must make efforts to get as healthy as possible before surgery. Smokers should stop altogether and alcohol intake should be reduced to 1 standard size drink per day or less. A healthy diet is equally important, as your body will need plenty of energy, protein and vitamins to rebuild. I also recommend that patients consider taking additional vitamin supplements in the month prior to surgery. Step 4. Lose weight. If you're overweight, losing some pounds can make recovery easier and safer. Although weight loss is recognised as being difficult when mobility is reduced, hopefully following steps 2 and 3 will help. Occasionally, for people who are seriously overweight, it's sensible to delay surgery or even to consider a weight loss procedure prior to a hip or knee replacement. Whilst weight loss may be advisable for a patient undergoing surgery, as mentioned earlier, it's important to be well nourished before the operation, and a very low calorie intake in the weeks immediately prior to surgery should be avoided. Step 5. Ensure that any long-term health conditions are well controlled. It's important to have any pre-existing conditions such as diabetes, heart disease or raised blood pressure carefully looked at and treated prior to your surgery. Step 6. Identify your treatment buddy. Your buddy should be on hand to provide practical assistance and help you keep organised and motivated. They will attend appointments with you, ask the questions that you may forget, take notes and generally support you through the process. Ideally, your buddy will be able to take you home from hospital and will be on hand during the first week or 2 to help you with practical matters at home. If you don't have anyone who can help you, we can support you to work around these issues. Sometimes it's helpful to arrange for a short stay in a rehabilitation facility. Step 7. Let work know. The amount of time that people need to take off work following a hip or knee replacement is quite variable. This seems to depend on personal motivations, level of fitness, the nature of the work, and how the patient makes their way to their job. Whilst most people would be back online checking emails within hours of surgery, it's usually necessary to take a couple of months off work and after this time to consider a phased return. Step 8. Arrange your home. With a week or two to go before surgery, it's important to prepare for your homecoming. You should stock up on foods, declutter, and remove items that you may trip on, such as loose carpets and cables. Think about reorganising some of the cupboards in the kitchen so that commonly used items are easily available, not on the top or bottom shelves. You should arrange an armchair to be easily accessible, as low sofas are best avoided initially. We can advise you on a variety of gadgets that can make life easier, and at your pre-assessment review we will also talk about the use of raised toilet seats. If you're a little unsteady on your feet, it may be sensible to arrange for extra grab rails to be fitted on the stairs or in the bathroom. You should also ensure that your bed is fitted with clean sheets and that your towels are fresh, ready for when you return home. Step 9. Last minute arrangements. Please let us know immediately if you have any concerns regarding a new illness or a change in your circumstances at home. Prior to coming to surgery, you should pack a bag with all the usual essentials necessary for a few days away from home, but please avoid bringing valuables. You should include loose, comfortable fitting clothes and slip-on shoes together with a good book. At your pre-assessment review, you will have been advised regarding stopping medications such as aspirin and other blood thinners prior to surgery. You should also avoid taking herbal medicines in the 2 weeks prior to your admission date. Step 10. Coming in for surgery. At long last, the day has arrived and it's time to say goodbye to your arthritic joint. Please take a shower on the day of surgery, but do not shave or apply any perfumes or ointments to the leg. We recommend that during the 6 hours prior to surgery, you have nothing to eat, but continue to drink water up until 2 hours before the scheduled time of surgery. Well, that concludes my recommendations for the preparation period prior to hip or knee replacement surgery. Of course, there are many different ways to prepare for surgery, and the most important thing is that you consider how the operation is going to affect you and what you can do to improve your chances of having a very smooth and easy transition from the hospital back home. Of course, you should speak to your surgeon and the nurses working in your hospital prior to the operation in order to make sure that your preparations are appropriate. Thank you for listening, good luck, and goodbye.